This short video demonstrates how to formulate a clinical question using the PICO framework. We use the PICO framework to define our research question in order to create a systematic search of research literature. A well-defined research question helps define the scope of a literature review and now allows us to assess articles for eligibility and inclusion in our review. PICO stands for Population, Intervention, Comparison, Outcome. We are going to look at each of the PICO elements in more detail. P stands for population or problem. Who are the people under investigation, or what is the condition or presenting problem we are interested in? This can be very general, humans, or very specific, trained female athletes between the ages of 18 and 25 with soft tissue injuries. I stands for intervention or idea of interest. What are the researchers doing? Again, this may be general, exercise interventions. Or it may be very specific, resistance training. C stands for comparison. This may be difficult to define at the beginning of your research. Are you comparing two different types of therapies or interventions? Are you looking for a comparison between a single intervention and no treatment or a placebo? Often we are not clear on the comparison until we begin reading the research literature to see what kinds of comparisons are used by researchers in the field. O stands for outcomes of interest. What effect are researchers looking for? This could be as simple as weight loss or as complex as measures of cardiometabolic risk such as blood pressure, cholesterol levels, waist circumference, and blood glucose. Here's an example. We have listed the corresponding information for each component of PICO for our research strategy. Our population is adults with osteoarthritis. Our intervention is glucosamine supplementation. Our comparison is placebo or non-steroidal anti-inflammatory drugs, NSAIDs. Our outcome is pain. When writing our research question, each of these elements is represented. For adults with osteoarthritis, is glucosamine effective for reducing pain compared to a placebo or NSAIDs? Often we find that the elements of our PICO framework change and shift as we begin to survey the literature. You can also adjust your outcomes to broaden or narrow your criteria. We can adjust our outcome of pain to include pain and function to increase the number of results. Or we can narrow results by focusing on WOMAC score as a measure of pain. A well-defined research question allows us to craft a systematic search strategy and helps find the most relevant research literature to inform clinical decisions. For information on building a systematic search strategy in PubMed, watch our video on this topic. Need help? Ask us. Chat, email, phone, or drop by. This concludes our video on formulating a clinical question using PICO.